Hello friends, welcome back to my channel. So today we are going to discuss MCQs on the subject human anatomy and physiology. The first question, mesangial cells are found in option A bone, option B glomerulus, option C skin and option D brain. Here the right answer is option B, that is glomerulus. And about the mesangial cells, these cells are specialized cells in the kidney that make up the mesangium of glomerulus. And about the main function of these cells, it generates interleukin 1. Okay, it generates interleukin 1. Interleukin 1 are cells which fights infections, and also these cells produce platelet derived growth factor. Next question, T lymphocytes mature in. So where does the T lymphocytes mature? Option A spleen, option B thymus, option C lymph nodes and option D red bone marrow. Here the right answer is option B, that is thymus. Next question, the aperture of human lens is option A cornea, option B iris, option C pupil, option D retina. And here the right answer is option C, that is pupil. Pupil is the aperture of human lens. Next question. Sphincter present between esophagus and stomach is option A OD sphincter, option B pyloric sphincter, option C urethral sphincter and option D cardiac sphincter. Here the right answer is option D, that is cardiac sphincter. Cardiac sphincter is also known as a lower esophageal sphincter. As you can see in the picture, lower esophageal sphincter is between the esophagus, the lower portion of the esophagus and the upper portion of the stomach. And about the function of lower esophageal sphincter, it regulates passing of food from the esophagus into stomach, and also it prevents the contents of stomach re-entering the esophagus. And about the pyloric sphincter, it is between the lower portion of the stomach and the small intestine, and it regulates the passage of food out of the stomach to the small intestine. And about the sphincter of Oddi, it regulates the secretion of pancreatic juice and bile into the small intestine. And also, if you are talking about urethral sphincter, it regulates the outflow of urine from bladder to the urethra. Next question, the number of spinal nerves in human is option A 27 pairs, option B 31 pairs, option C 37 pairs, option D 47 pairs. Here the right answer is option B, that is 31 pairs. Next question, wedge shaped organ is wedge shaped organ. Option A liver, option B duodenum, option C loop of Henle and option D none. Here the right answer is option A liver. Okay, the shape of liver is wedge shaped. And about duodenum, it is C shape. Okay, the shape of duodenum is C shaped. And about loop of Henle, it is U shaped. Okay, the shape of loop of Henle is U. Next question, how many bones does a newborn human baby have? Option A 305, option B 206, option C 211 and option D 411. Here the right answer is option A, that is 305. In a newborn human baby, the human baby has 305 bones. Okay, 305 bones in the body. Next question, reserve pacemaker of heart. Option A SA node, option B AV node, option C bundle of His and option D Purkinje fibers. Here the right answer is option B AV node. AV node is the reserve pacemaker of heart. And what about the pacemaker of heart? It is SA node. Okay, SA node is the pacemaker of heart and AV node is the reserve pacemaker of heart. Next question, which cranial nerve originates from the lateral rectus? Option A trigeminal, option B vagus, option C trochlear and option D abducens. Here the right answer is abducens. The cranial nerve abducens is a nerve which originates from the lateral rectus. Next question, bending backward is called option A extension, option B flexion, option C rotation and option D none. Here the right answer is option B, that is flexion. And about extension, it is the opposite of flexion, that is bending straightward. Okay, opposite of flexion is extension. Next question, the heart rate of fetus is option A 140 to 150 per minute, Option B 65 to 75 per minute. Option C 100 to 125 per minute. And option D 70 to 85 per minute. Here the right answer is option A, that is 140 to 150 per minute. Okay, the heart rate of fetus is option A, that is 140 to 150 per minute. Next question. Which enzyme hydrolyzes terminal peptide linkage containing lysine and arginine? Okay, which is the enzyme that hydrolyzes terminal peptide linkage? Okay, which containing lysine and arginine? Option A carboxypeptidase A, option B carboxypeptidase B, option C aminopeptidase, and option D enterokinase. Here the right answer is option B, that is carboxypeptidase B. Okay, carboxypeptidase B is the enzyme which hydrolyzes the terminal peptide linkage containing lysine and arginine. Next question. Which part of the brain controls the heart? Option A spinal cord, option B medulla oblongata, option C neuron, and option D none of this. Here the right answer is option B, that is medulla oblongata. Medulla oblongata is a part of the brain which controls the heart. Next question. Which of the following tissues contains collagen? Option A cuboidal epithelium, option B white fibrous tissue, option C adipose tissue, option D columnar epithelium. The right answer is option B, that is white fibrous tissue. Okay, white fibrous tissue contains collagen. Next question. Blepharitis is. Okay, what do you mean by blepharitis? Option A inflammation of eyelid, option B inflammation of muscle, option C inflammation of bone, and option D baldness. Here the right answer is option A, that is inflammation of eyelid. Okay, blepharitis is the inflammation of eyelid. And what about option B, that is inflammation of muscle? It is known as myositis. Okay, inflammation of muscle is known as myositis. And about inflammation of bone, it is osteomyelitis. Inflammation of bone is osteomyelitis. Next question. Which is the most abundant plasma protein? Okay, most abundant plasma protein. Option A albumin, option B mitochondria, option C alpha beta globulins, and option D hemoglobin. Here the right answer is option A, that is albumin. Okay, albumin is the most abundant plasma protein in the body. Next question. Excessive production of aldosterone result in. Option A Frolic syndrome, option B Conn syndrome, option C Cushing syndrome, and option D Graves disease. Here the right answer is option B, that is Conn syndrome. Okay, excessive production of aldosterone result in Conn syndrome. And about option A, that is Frolic syndrome, it is a condition where growth hormone FSH and LH is decreased in children, especially in children. That means it delays the physical growth and development of sexual characteristics in children. And about the option C, Cushing syndrome. In Cushing syndrome, we know that there is increase in the cortisol secretion. Okay, in the body there is increase in the cortisol secretion. And about Graves disease, there is increased secretion of thyroid hormone. Okay, there is increased secretion of thyroid hormone. Next question. The functional residual capacity is measured by option A thermography, option B plethysmography, option C phonocardiography, and option D perimetry. Here the right option is option B, that is plethysmography. Next question. Albright syndrome is a disorder of option A bone, option B cartilage, option C blood, option D both A and B. The right answer is option D, that is both A and B. Okay, Albright syndrome is a disorder of both bone and cartilage. Next question. A curvature of the vertebrae in the lower back is option A rickets, option B kyphosis, option C lordosis, and option D scoliosis. The right answer is option C, that is lordosis. Okay, curvature in the vertebrae in the lower back is lordosis. Next question. Snellen chart is used for. Okay, what is the use of Snellen chart? Option A measuring field of vision, option B measuring intraocular pressure, option C for eye reading test, and option D both B and C. Here the right answer is option C, that is for eye reading test. Okay, Snellen chart is used for eye reading test. Thank you so much for watching. If you find it useful, please do subscribe the channel and share it to your friends.